Wants to grab food, do it now. I think they're packing up and going through to make sure before they leave. If you hadn't grabbed food yet, make sure you do that as they're getting ready to close up. All right, and our next speaker is Lena Ramsay around ketamine therapy.
You need food.
Yes, I haven't eaten except for what I ate off of yours. I took it out of the coffee bin thing so that it wasn't just sitting there.
We do. We definitely do.
Oh, I need this because I'm going to get us some tinctures too. So I'll be back. Lafayette Farms has one.
No.
Yeah, we'll go over there together. I know. Yeah, okay.
Hi, my name is Lena Ramsay, and I'm here today to talk to you about ketamine therapy within the VA system. So speak up or turn it up. I don't know.
Get it closer to your mouth.
Okay, is that better? All right, sorry about that. So many people don't even know that ketamine therapy is an option within your VA system. And if I had, if I could tell you all the vets that realize that there is ketamine that is available both for pain management and for depression, PTSD, and anxiety, it is something that we are entitled to as veterans. I was a combat veteran in Afghanistan and suffered with PTSD and anxiety and depression and was on every different kind of medication imaginable that the VA threw at me. And it took me coming to the state of Maine and realizing that we are entitled to that benefit, to ketamine. They are currently offering ketamine treatment out of Togus, and you can access it. It is very tricky to be able to access this benefit, but I can tell you how to do that. And there are different forms of ketamine. So I'm going to start out, I guess, by telling you that the forms that are available and that are covered by the VA is IV, IM, intermuscular, and the S-ketamine that you would take through, I think the nose is what they're doing up in Augusta. And the thing is that your primary care physician does not know about this benefit. So it's not like you're going to walk in and ask the primary care physician to be able to do it. You have to get a referral to your to mental health. If you have a mental health case manager within your VA already, that is the person that can open the door for you for getting ketamine treatment. You have to advocate for yourself. It's pretty much not as easy as just doing that. They look at a lot of different reasons to not give it to you. One of the main reasons that you can get it is medication-resistant depression, or depression that has lasted for longer than a year, and you have had at least 2 separate medications that that have not worked out for you. Then what they can do is they can refer you up to Togus here in Maine, and they have to refer you up to Togus here in Maine. There's a lot of exclusions, and I actually printed up a list of exclusions. But if you know what the exclusions are, then you're able to work around them. Ketamine is considered a pseudo psychedelic, so it's not like the psilocybin or some of the other psychedelics that are out there. It is more manufactured and more treated as a medication. However, some of the exclusionary things that you cannot have and be referred to, the veteran referred to Togus or referred to the community for ketamine, is any kind of dementia, any kind of schizophrenia, any kind of history of that. And I'm looking right now at the exclusion criteria. They will drug test you. You cannot have a positive THC test, but there's ways around that. And I am here to tell you that one of the best things that you could do is ask for beautiful, right?
It's your own flyover.
Yeah, that was amazing. That was amazing. And they want to look at your heart issues. They want to see if you have any kind of a heart issue. So you have to have an EKG and you have to have a yearly physical. If you get a community referral for ketamine, then you don't have to worry about the THC. The only community referral in Maine where you can actually go to is Acadia Northern Lights. But they have a ketamine clinic in Portland. They have a ketamine clinic in Bangor. And very sadly, the waiting list for that is quite long. So one of the things that they have done is cut down the number of sessions that you can get. You used to be able to go endlessly, and you don't want to go endlessly because long-term ketamine use can play havoc with your, internal organs. I mean, it can happen. However, to get out of a hard-pressed, depression or anxiety or a PTSD episode, it is a really great answer. You also must be willing to have therapy while you're going through the ketamine clinic. This does not mean that you have to get your therapy
Speak up! Can't hear you louder!
I know. This does not mean that you have to get your, what was I saying?
You got to be in sessions.
I'm sorry, yes. I know. It does not mean that you have to get your therapy through the VA. You can go to outside therapists and you don't even have to tell them who that is. They have no right to know who your therapist is, not even if it's with the vet center. You can tell them that you have outside therapy and you don't wish to provide that information, and you don't have to. That is very, very simple. There are a long list of drugs that you also cannot be on if you're doing ketamine, and they will go over that, with you. Like, you don't want to be on benzodiazepines. Or anything heavy, like they're not going to refer you if you're on an opioid, but they're not doing that anymore anyway. Pain pills, they're not doing that anymore anyway. And believe it or not, if you are suffering with alcoholism in any way, shape, or form, one of the things that ketamine does is makes you just not want to drink anymore. So as long as you don't drink the night before you go in for a ketamine treatment, you're pretty much okay. You're good to go. But again, some of the disorders that you cannot have and work with psychedelics, and this goes for all psychedelics actually, it's not just ketamine, is it seems like studies are now showing that some of the things that may make you inappropriate for working with them is, like I said, schizophrenia, bipolar, dementia, stuff like that. Now, ironically, if you get a referral for ketamine within the community, one of the things they're going to try to put you towards is ECT therapy, if anybody knows what ECT therapy is. That's not a good therapy, in my humble opinion. Because what they do is they zap your brain with electrodes to try to get your memories of any kind of incident out of your head. And if you have ever had a TBI, that's your way out. That is absolutely what you can tell them is, I'm not appropriate for any kind of ECT because I have a TBI and I would be prone to a seizure. So that is one answer to that question that you can get out of. Your blood pressure always goes up on ketamine. So they do monitor that before you go into the program. If you have a lot of high blood pressure, they're going to monitor that. But again, you're going to have the EKG. One of the areas that ketamine is difficult on your organs is on your bladder. So if you have like any kind of renal issues, that may also keep you from doing it. But other than that, there should be no reason that you cannot get that referral. One of the hardest things that vets face in order to be able to do ketamine, and I suspect it's going to even get worse as we're approving the psychedelics, is that you have to end up having somebody give you a ride home. And that is tricky because there's not any veteran organizations out there that will offer you that particular ability to have a ride. When I first started working with the ketamine clinic, I live like an hour and a half away from the clinic. So I have to have somebody take me there, and they want you there at like 6 o'clock in the morning. To get to my house is like an hour away from anything and anybody. So that is one of the obstacles that you have, and it's the same up in Togus, but since they're using S-ketamine, which is like a lower form of it, it's not IV and it's not intramuscular, then what they are doing is they're allowing for you to be able to have a ride in a little different appointment setting, but they will never ever offer IV at a VA for the simple fact that they're not going to be able to staff the people and watch you after those treatments. So in my opinion, the best thing to do is to get referred outside of the VA. And you can also do it if you get referred to a pain management clinic that offers it. You can also look at getting ketamine. I'm a big advocate of it because it is something that people that might have a fear of trying psychedelics would actually think about getting their foot dipped in that water in a hospital setting where you're having people watch what you're doing, and they feel a little bit better about doing that. And I have a really unique way of telling you how to try it before even trying it. And I've been speaking about ketamine for about the last year, 2 years, and on a national level. So I've talked to people as far away as in Oklahoma on how to get these referrals into their VAs or into the community care systems. And one of the things that you can do is any outpatient procedure that you have when you go for an outpatient procedure, including a colonoscopy, is tell the anesthesiologist that you want ketamine. They will give it to you. And most of the anesthesiologists in the hospital in anywhere that I've been to in Maine are happy to do it because it is a very interesting drug that allows you to go in and out very easily, very smoothly. You don't have a lot of the combative behavior that they're used to. So, of course, they're willing to absolutely give that to you. And there is enough of a dose there that you should feel different. So if you're going for a scope down or up or however, you just ask them to be able to do the ketamine. Tell them that you want it. Say, I insist on ketamine. And then check out how you feel within the next week or the next 2 weeks. And that is one way that you can kind of dip your feet in and see if it is something that you would be interested in. I love the doctor at the Acadia Northern Lights Bangor office who I have been trying to work with to open up more slots for veterans. And he is slowly getting more veterans in. It seems like Bangor VA is getting a little bit more friendly with how they're doing the referrals. And again, if you get an outside referral, as long as you don't test positive for THC within the VA and they stop by not giving you that referral, then you are fine to go forward. And if you get a positive for that, you're okay. There is no efficacy problem with ketamine and THC, so that shouldn't be an issue, but they make it an issue. And again, these referrals are not going to come from your primary care physician. You have to go through your med manager, your med case manager. And if you want a referral and the primary care physician tells you that they're not going to give it to you, then you keep pushing for that mental health case manager referral. And most of these people are getting really full and trained on ketamine because they're getting ready, as you've heard, to train on MDMA and psilocybin. It is not happening here in Maine as of yet. And I just checked literally before I came here to talk today. These trainings are not happening here yet, but they are coming. They will definitely be here in the very near future. I'm trying to think of anything else I can tell you about getting a ketamine referral. Pain management, you will have a longer duration under ketamine if you do it through pain management. But again, they're not going to do the IV treatment in Togus. It's just not going to happen. You're going to have to find and do a little bit of lead work on where your community referral place will be. And again, the research that I've done has shown that it is Acadia and that it is Northern Lights healthcare system that is taking VA referrals. Ketamine is cheap. It's very, very inexpensive. But if you look all over the country, and I came from Colorado, so I can tell you that as soon as they started approving ketamine in Colorado, all these clinics popped up. And in order to do 3 doses, and sometimes 3 just IM intramuscular doses, you're going to spend about $2,000, which is ridiculous because none of us can afford that. None of us can afford that. But what they don't tell you is, again, this is something that you're entitled to within the VA. So you're absolutely able to go get it. My Facebook page is Veteran Psychedelic Network, and you are able to get on that page. And I think I have, Lenny, don't I have the document attached to there? I think I have the ketamine document attached.
Yeah, I think so.
So I will be updating that because there's a lot more information coming out with that that needs to go in there. But pretty much everything I've said here today and how to get referred is in there. Plus my contact information is in there. And if you call me and you are anywhere within the state of Maine or even outside of the state of Maine, I can find out exactly who you need to go to and how you can get the referral and how you can fight for the referral, which you shouldn't have to, but sadly that is what is happening, is that you really have to fight for it. That pretty much is everything that I want to say, unless anybody has any questions. Nope. All right, thank you.
Thank you, Lena. Yeah.
Thank you very much. Really appreciate that. All right, and next we're going to bring up Lenny Richards to talk about growing mushrooms. Oh, look, he brought some samples. Look at this.
Cheer everybody up.
Get done already? Can I
No.
buy tickets down there?
You'd have to ask the wife over there.
All right, I'll ask.
Hello. Hi. All right. I'm going to do a little talk on growing your own. No way condoning breaking any kind of laws at all. So what I'm teaching, I'm going to tell you what is against the law, right? Is you can have, like mushrooms come in syringe spores, right? Those are perfectly legal to have. But as soon as you put psilocybin mushroom spores into one of these bags, that's when you break the law, right? But you can use the same bag for gourmet mushrooms. And that's what we're going to talk about. It's how to grow those kind of mushrooms. Psilocybin mushroom syringes, the reason why you can mail them and the reason why you can have them in all but 3 states is because they're for microscopy use only, meaning you use them to put the liquid or the seed of the mushroom, if you will, under a microscope and study it. Okay? That's how we get away with that. That's how that works. I'm just closing that up here. So what I have here is a monotub, right? It's an all-in-one grow kit. Okay? So the grain bag I showed you, you would take your gourmet mushroom. You know, you would inject it into here. Yeah, so like I was saying, you'd inject it into here, right? And then about a month and a half, there'll be mycelium. Like there'll be some white growing in there. You'll wait till the bag is about... You'll wait till the bag is about 50% white, then you'll mix it up again. And then you'll wait another 2.5 weeks until the entire bag is white. And you'll let it get solid white. And from there, this bin here is called a monotub bin, right? mix this grain bag that's all white with mycelium with your gourmet mushrooms, or other dung-loving mushrooms, if you will. And then you layer it. You can make all this yourself, right? You can make the grain bags, you can make the substrate. I don't do that. I buy mine personally because that works for me. I have brain damage and I like to keep things simple, quick, and easy, right? So having to make my own, that's a lot of process you have to remember, because growing mushrooms, you have to be sanitary, right? Because by nature, they're a fungus, right? So, it welcomes that. So in here is substrate. So this is a manure substrate, but some of the other mushrooms you can grow use wood substrate, right? So depending on what type of mushroom you're growing, what kind of substrate you need. But the same basic principle, right? So once you mix it, a layer, right? You got the grain bag and you got the substrate, kind of like a lasagna, make a layer, okay? And this is the lid. And these are the filter patches that you put in the holes, over the holes right there. And then you just take that, put it on top, and that's it. Everything, if you did everything correctly, everything grows inside this one bin. So by the time you get to this point, within a month and a half to 2.5 months, depending on the kind of mushroom you're growing, so a month and a half to 2.5 months, depending on the type of mushroom you're growing, they'll start pinning and you'll have your own mushrooms. What's exciting about that is, as I've talked about earlier, I know people that will grow active psilocybin mushrooms as medicine. And so this allows you, if you understand the laws that I'm telling you not to break, but you can try to grow your own medicine if you want. That's a risk that everybody has to choose on their own. I'm telling you not to do it, but it's really easy. And depending on the mushrooms you grow, on a manure substrate, dung-loving mushrooms, 68 to 72 degrees from start to finish, I find is comfortable. Because when you're growing mushrooms inside this thing, you don't want to open it, right? Because it's already contaminated. It's a dirty environment, if you will, so you don't want to open it. And you just want to make sure that there's enough moisture on the inside. They also make what's called all-in-one grow bags. Same thing, all this, but it's in one bag. So you take the needle and you inject it into the bag, and then everything grows in there, right? And so for people that they're growing their medicine on their own, that's something you can put in a refrigerator, on top of a refrigerator in a cupboard. Perfect environment for it. And then the medicine is, the psilocybin mushrooms. It'd be enough medicine for one person, as CJ was saying, to microdose for months. Something like this, growing your own medicine, and something like this, for microdosing purposes, depending on the strain, you could get close to 6 months to a year worth for one person out of something like this. It's a lot, mind you. I find it's kind of easy, and I enjoy the different strains that come up. And depending on the strain and the genome and things like that, there's different challenges that come along with it. And I won't go into that. It's very specific. But that's a quick little snapshot of how to grow mushrooms. I simplified it a lot. Like I said, I have brain damage, so I really like to keep things simple and take away a lot of steps. So, again, my name is Lena Richards. I represent Veteran Psychedelic Network, and thank you.